I'd like to invite you behind the scenes as we accompany specialist physician Dr Pieter Roelofse at the COVID intensive care unit at Melomed Belville. We start off inside Dr Roelofse's rooms as he prepares for his day at Melomed Belville.
So I start off with my ICU round, the main ICU, which is uninfected, no COVID patient there. And that takes me a lot of times between an hour, 2 hours, depending on the patient volume. And after that, I go to the medical ward, which is not COVID infected. And it takes me about 5 hours to do the rounds in this suit, which is hot, you can imagine. Sometimes 5, sometimes 6, all depending on the patients. So it's not only the physical toll it's taking, you can imagine the emotional toll. And when you've got the suit on, you can't eat, you can't go to the bathroom. That is it for 5 hours. Everything is here. And you go through a checklist the whole time to make sure you've got everything on. So, then I'm going to put on inside. You can just imagine now, it's just getting worse by the second. So this is very hot. I take my clothes with me and my shoes, because when I get out of the COVID ward, I go to an area where I doff, take off all the clothes and get undressed, clean yourself, and then you put on new scrubs to try and limit everybody's exposure in the rest of the hospital. It's not perfect, but there's a lot of patients up there, there's a lot of sick patients. I admitted actually a family of 3 yesterday, last night. I haven't seen that before. Everybody they all stayed together, all COVID positive, and they're quite sick, so I'm actually concerned about them. Okay.
Our doctors and nursing staff toil around the clock to take care of our patients. And as Dr Roelofse explains, the real heroes are our nursing staff.
And all this preparation was actually done before we started getting busy. And that was a very important advantage of the lockdown. We were properly prepared. And the last month we actually did see a dramatic increase in admissions for sick people. Yo, out of breath already. Water. These people, they're the real heroes, eh? Every day they come to work. You guys should remember that. Every day. Help us. So Rika is doing the running in between the wards. You'll see the sisters working in the COVID ICUs can't go out. So whenever they need somebody, Raika, they will call Raika and she would take stock for them, whatever they need. So these people, in my opinion, the healthcare workers, they're the real heroes, coming to work every day. You see how I'm dressed, they're dressed exactly the same. 12 hours in that COVID ward ICU. I promise you, that's very tough. So in my opinion, they need so much credit, these people.
And moments later, we got to witness how Dr Roelofse and team successfully intubated a patient.
Put on the introducer. Put in the introducer. Stop. Extend the head for me. Extend the head for me. Extend it more. Extend the head for me. Well done, Binky. Well done. Look at me. Well done. A lot of people need admission. The ones that get admitted, they just need a bit of oxygen, okay, because they're short of breath, quite distressed. And it's a small percentage of people that actually end up having non-invasive ventilation, like the lady there. And then, well, it's a 5% of people do get intubated, like we've just seen now. And the last month we haven't intubated that many, but she didn't have a choice now, this morning.
At times, patients do not get to see their family, and the nursing staff and doctors become their family.
He's been in hospital now for 3 weeks. And this is the worst part for me. Okay, he's alone here. Okay, we're the only family now. Hallo julle. En Auntie Susie kyk baie mooi na hom en sy behandel hom baie met baie liefde en alles, hoor? Onthou dit net. Ons probeer ons beste. Ek dink aan julle, hoor? Groete vir die kinders en almal daar by die huis, hoor? Bye bye, bye bye. I say one of the most difficult things here is to decide when it's enough. When you've tried everything and not to lose hope. Because if you saw him yesterday and you saw him today, it's like this. It's just a complete different man. Yesterday I was thinking of getting him off the ventilator, and now. So this is just taking its toll on everybody in here. Susie's been looking after him for a lot of time, the majority of the time he's been spending in here. So you can just imagine the emotional toll this is taking on staff members. I'm not only talking about the family members, but on staff members and the doctors, obviously. Because you get hope, and you come here this morning and things have just changed dramatically. And I mean, if you listen to that conversation with the family this morning, that's just for me too much. You can't even cry in this suit. That's too much.
Thank you to Dr Pieter Roelofse, a specialist physician at Melomed Belville, for taking us behind the scenes, and as you witness the work being done by our doctors and nursing staff who put our patients first. From all of us at Melomed, take care of yourself, take care of your family, and ensure that you wear a mask, sanitize your hands regularly, and ensure that you practice social distancing. Goodbye.